Severity measure for panic disorder is an emerging measure developed by American Psychiatric Association in 2013. The author for this assessment are Karski M., Richard U., Bogle S., Stein M., Andrew G., and LeBeau R. The information obtained from this assessment reflects the definition of panic disorder in DSM-5. Therefore, this assessment is being used in research and evaluation as a useful tool in medical decision-making.
The purpose of this assessment is to assess the severity symptom for panic disorder in an individual. Second, to monitor treatment progress.
Okay, for this assessment, the type of this assessment is self-reported assessment.
There are three components that have been assessed in this assessment, which are thought, feelings, and behavior.
For the indication of this assessment, it is for adult 18 years old and above. Second, already diagnosed in panic disorder. Third, individual who have clinical significant symptoms that fall short of meeting full criteria of panic disorder.
Hi, good morning, Miss Fina.
Morning.
I am your therapist for today. I'm Nina. So we will do an assessment called severity measure for panic disorder. So I would like you to respond each item by ticking one box per row. And you have to rate the severity of your panic disorder during these past 7 days. Can you do that?
Yes.
If you have any questions, please ask me. Each item on the measure is rated on a 5-point scale. 0, never. 1, occasionally. 2, half of the time. 3, most of the time. And 4, all of the time. The total score can range from 0 to 40, with highest scores indicating greater severity of panic disorder. The average total score reduces the overall score to a 5-point scale, which allows the clinician to think of the severity of the individual's panic disorder in terms of none, 0, mild, 1, moderate, 2, severe, 3, or extreme, 4. If 3 or more items are left unanswered, the total score on the measure should not be calculated. Therefore, the individual receiving care should be encouraged to complete all of the items on the measure. If 1 or 2 items are left unanswered, you are asked to calculate a prorated score. The prorated score is calculated by summing the scores of items that were answered to get a partial raw score. Multiply the partial raw score by the total number of the items on the severity measure for panic disorder. Example 10, and divide the value by the number of items that were actually answered. Example 8 or 9. So the formula to prorate the partial raw score to the raw score is raw sum multiply 10 divide by the number of items that were actually answered. If the result is a fraction, round to the nearest whole number. So based on the form given, there are 2 items that left unanswered. So the total partial raw score is 25 based on the questions that are answered. And the prorated total raw score is 31. So average total score is 3, which is severe.
For the reliability, no reliability found in which no research have been conducted or established this assessment. Next, for the advantages for this assessment. First, it is easy to administer. Second, do not require specific tools or manual to use this assessment. Third, specifically for patients who have panic disorder. Fourth, short time to administer.
The winners for this assessment is the client tend to underestimate or overestimate because it is self-reported. And it does not have psychometric properties.